歡迎大家嚟。
Good afternoon. Welcome to today's press briefing. We have two doctors on the stage, Dr. Albert O, Principal Medical Health Officer from the CHP, and Dr. Larry Yip from the Hospital Authority. Dr. Au, please. Good afternoon, friends of the media, citizens of Hong Kong. On behalf of the Center for Health Protection, I wish every mother in Hong Kong a happy Mother's Day together with their family. While we're celebrating the Mother's Day, please don't forget our infection control measures. Let me talk about the situation of COVID-19 as of the 7th of May 2022. Yesterday, 112 cases were tested positive, 23 confirmed by the HA, 11 confirmed by our public health service laboratory service branch, the rest by private laboratories. 154 tested positive via the rapid antigen test. Yesterday, altogether, 266 cases were tested positive. So far, during the fifth wave in Hong Kong, there were 1,193,954 cases tested positive. Via PCR, 746,912, and then 447 and 42 cases tested positive via rapid test. There were 25 imported cases yesterday, and the rest, 241 of them, were local. Out of the imported cases, 18 were found at the airport when they submitted their samples. 5 cases arrived on the 6th of May, and then on the 13th of them arrived on the 7th of May. Yesterday, we did not have to suspend any flights. 6 cases were found positive while they were staying at the quarantine hotels. 1 was found on the 3rd day via rapid test, another one on the 4th day via rapid test, and then 4 cases on the 5th day. 1 via nucleic acid test, and then the others by rapid test. And then the remaining 1 was found at the community testing center on the 12th day. It's a 9-month-old baby, and we examined the fecal sample of the baby. It was a positive case. 6 cases were arrivals from the USA, 5 from Singapore, and then some from Taiwan, India, UK. There were 12 from each of the 2 destinations, from Australia, Spain, South Africa, Germany, and Japan, 1 from each of those destinations. As far as the genomic analysis is concerned, yesterday 73 samples were examined and analyzed. We didn't find any positive towards L452R. 70 cases were found to be negative for L452R. 3 cases did not have sufficient viral load. For homes for the aged or the disabled, there was 1 which had a previous case or cases reported. Well, we talked about that yesterday. And there's at a Jockey Club home for the aged in Yuen Long under Port Hoi Hospital. He had got the 4th jab, and he's a caregiver, and in fact, this is a close contact of a colleague who was a close contact of a patron going to the Peony restaurant. On the 6th of May, there was a sore throat, and then on the 7th of May, before going to work, there was a positive test. The patient lived alone. We follow up on the home for the aged as well as the floor on which the patient worked. Since there was a patron going to Peony restaurant was found positive, 3 were found to be close contacts. They were residents of the home. None has turned up any positive tests. All the residents and the staff members have negative test results. For death cases, so far, we have recorded 9,133 death cases in the 5th wave, 2 more when compared with yesterday. The case fatality rate remains at 0.765. And then for those age 80 or above, it is 10.56%. As far as the Peony restaurant, I would like to update you with the situation. Yesterday, we took 8 environmental samples. All turned out to be negative. 2 were taken at the air inlet of the ventilation system, 2 at the outlet, and then 1 at the working bench, and 1 at a table, and 1 at a cashier. Well, for the close contacts, we found 4 more cases. And then they did patronize the Peony Golden Court. They attended the place on the 1st of May, including a 67-year-old female vaccinated. Together with a relative, she visited the restaurant. They had tea there, and their table was also roundabout in the middle of the hall. On the 7th of May, there was a mild cough. She patronized On the 5th, she had a mild cough. She consulted a doctor. Yesterday, she gave a sample, and then it's positive. As far as the relatives that went together with her, so far the tests were negative. And then another one was a couple with 3 doses. On the 1st of May, they patronized at that restaurant. Again, the table was in the center of the restaurant. A 56-year-old male. On the 6th of May, there was a mild cough developing. And then his wife was a 58-year-old female. On the 7th of May, there was a dry throat, and yesterday they undertook a rapid test, and the test results were positive. As to one of their family members, the test result was negative this morning, a rapid test. And then there was a friend of one of the patrons gave a sample yesterday. It's a nucleic acid test. It's a positive test. It's a 63-year-old male. As far as the case tracing center was concerned, 4 cases were announced, and 2 of them were sort of known to each other, and they had the meal together. So all in all, on the 7th of May, for those who went to the restaurant and fallen ill, there were 8 cases belonging to 5 different groups. 4 were found via nucleic acid test, and then another 4 via the rapid test. 3 groups had 2 cases each, and then the other 2, 1 each. Age between 47 and 67, 5 males and 3 females, 1 with no symptoms, 6 with mild symptoms. And they developed the onset of symptoms between the 3rd and the 7th of May. 1 case was still being investigated. 9 home contacts were identified. Home quarantine had been arranged. 2 of them had turned out a positive result for the rapid test. In addition to home contacts, for those who had meals together with the patients, there were 3 close contacts. 1 was having a positive test result, as I have referred to it. And then for the other 2 patrons, again, they are now under home quarantine. So far, for the rapid test for all the staff members of the restaurant, all the results are negative. Yesterday, we issued a compulsory testing notice. Anybody going to this restaurant between 6:30 and 9 a.m., both patrons as well as staff members have to undergo a nucleic acid test between the 8th and the 9th of May. That's all from me. Thank you.
On behalf of HA, I also wish the Hong Kong public a happy Mother's Day. Regarding the reports, we have 965 confirmed patients in the different public hospitals in North Langtao, in the Infectious Disease Control Center, AWE, and so on. Yesterday, there was 1 case in serious condition, and there's also 1 patient who is in serious condition, and 2 in ICU. The new serious case had 2 jabs. Another case in the last 24 hours had deceased, a 70-year-old male and an 82-year-old male. One of them is from an elderly home. One of them did not have vaccination, and one had 2 vaccinations. On the last day, there were 113 recovered patients, including 77 who had been discharged in the 5th wave. There have been 48,377 who have recovered, including 48,000 plus who have been discharged from hospital. Starting from 2020, there have been 61,000 plus patients who have recovered, and 60,000 who have been discharged from hospital. Today, we have no positive cases discovered at hospitals, and our staff, we have 22,000 plus who have been tested positive. 22,477 have already returned to their work position. That concludes my report. Please identify your media outlet before you raise questions. Hong Kong 01. First of all, we see that some people need mandatory testing after the restaurant outbreak. So could CHP disclose more details? Under what conditions do we need mandatory testing and mandatory quarantine? Previously, we only required relatives living together who had to be tested. But now if work colleagues or people who shared a meal or people who dined together, do they need to have mandatory quarantine as well? Another question is, today's Mother's Day, and a lot of people will be dining together at restaurants. So do you foresee that more people will need mandatory quarantine and mandatory testing? Now, referring back to the restaurant, you said that the environmental samples were all negative. So can you conjecture how the transmission vector occurred? Thank you for the question. Regarding the first issue about mandatory testing and quarantine, typically when a venue has an outbreak, including a building, if we discover a transmission, we might have to list it as needing mandatory testing. Then close contacts, close relatives might have to be quarantined. Typically, quarantines will be conducted at home. Previously, CHP had collected some infectious disease data and had conducted follow-up work. Now, in the past, we had too many cases. We had to rely on our 2 online platforms for PCR and RAT positive patients to disclose their personal information, their work address, their home address. Now, if cases were not reported, we would also conduct telephone survey to collect information. We would conduct analysis to see if there was any congregation or outbreak. Previously, we focused on their residential address. If there are a lot of cases in the residential address, then they will come under mandatory testing. Now cases are coming down. We are therefore following up more closely. So we will collect more information. We will trace their whereabouts. And once this information is collected, we will also conduct analysis. And the purpose is to see whether certain locations have an outbreak, and we will also try to identify the close contacts. And during the infectious period, when did they meet face-to-face and when did they not wear masks? So if we identify high-risk individuals, we will require them to conduct home quarantine. Now, if their home is not suitable, we will arrange them to stay at our quarantine facilities. Now, previously, we had conducted investigation, but when their cases were too numerous, we had to focus on high-risk areas such as schools, residential care homes. The residential care home contact tracing We are now at the level pre-fifth wave. When we discover close contacts, we will send them to AWE and quarantine centers. So with the cases coming down, we want to strengthen our epidemiological close contact tracing. Now, regarding Mother's Day, more people dining out. Yes, dining out will lead to higher risks because people will not be wearing masks, but I think our restaurants are complying with our regulations regarding ventilation, environmental hygiene, and so on. They are meeting all our requirements, so we are minimizing the risk of outbreak. So I also encourage the public, if you have symptoms, then do not venture out. If you are infected, if you discover you're infected, if you're positive, avoid public areas and stop the spread of transmission. The hot pot restaurant, well, we have identified 8 cases. Their location, seating location, in the Peony restaurant, according to what they told us, they were located in the central dining hall area. So maybe when they were entering or leaving, they might have a short contact, or when they were dining, they also had their masks removed. So we can't rule out short distance transmission. We had this occurred previously, when we have super transmission or invisible cases, there might also be environmental pollution. So when we collected environmental samples, we found it was negative, but it had already, these samples were taken at a subsequent stage. So we cannot rule out close, short distance transmission. Next question. Now TV. The Yunlong restaurant, you said there were 190 patrons. So how many patrons have you found? In the contact tracing, you say you will follow up more closely, but not all people will receive a phone call. So when can you follow each case and where they have been? The hot pot restaurant, we have to rely on Leave Home Safe app and other information. When the patrons visit the restaurant, they have to swipe the Leave Home Safe app, and that is how we collect information. So there were roughly 190 patrons of the restaurant. We had issued SMS and reminded them they had to comply with the notice and conduct testing. So they have to test between the 8th and 9th of May. We will follow up on these cases. And currently we have found 8 cases. There are 4 cases, new cases today, which were discovered through our close contact tracing or through their own testing. We will monitor the situation and see if any new cases can be discovered. Second, regarding close contact tracing, we are trying to identify each case, and we want to uncover their travel history and see whether there were any close contacts during the infectious period. We had done this work before, but previously there were too many cases. The information we collected, we had to rely on the patients and disclose it through the online platform. So if they did not make a report, we will try to identify them, we will try to locate them by the phone. And now cases are coming down, so we hope to have more information, not just their work address and residential address. We might have to collect their travel history 2 days prior to their infection, including restaurants they might have visited. We will try to uncover whether there have been outbreaks in high-risk areas. We can issue testing notice, and we can also arrange testing for people who had dined with them. Next question.
Good afternoon, doctors. I'm from Ming Pao. For the patrons, well, yesterday you didn't actually talk about the variant confirmed. Now that the genomic analysis has been carried out, I just want to confirm whether it is the one prevalent in Hong Kong. For the 4 patrons identified yesterday, have they all been vaccinated? And then for the compulsory testing, has it been completed covering everybody? Is it that so far only 4 are positive, as you told us yesterday, and then the rest are negative? Now, today, the restaurant is operating after the disinfection yesterday. So what is the risk of infection as part of your assessment? In the past, I think when we were at the peak of the pandemic, you only relied on self-reporting from the people infected. When are you going to resume the in-depth epidemiological investigation? Can you tell us about the threshold? And what sort of contact tracing are you going to carry out? 2 days before onset of symptoms or 2 days before the positive case? Well, 1st of May was the day in question, but then people only developed their symptoms on the 4th of May, say, for example. So what sort of tracing would you cover? When you do carry out such in-depth tracing, since more citizens are doing the rapid test instead of the PCR test, so it won't be facilitating any genome mapping. So how can you tell whether they belong to the same cluster? For the HA, today you reported 2 death cases, which came from a home for the aged and which one had a vaccination record. For the 9-month-old baby, having a positive test result on the 12th day, a baby girl or baby boy, and the place of origin place. And then yesterday you talked about a 24-year-old girl from Singapore, and then she tested positive on the 12th day. What about people living on the same floor of the quarantine hotel? Let's answer the questions first. Thank you for your questions. The first question was about the variant involved. For the 8 cases, 4 underwent a nucleic acid test. So we're going to refer the sample to the Public Health Laboratory Services branch for mapping to find out whether the variant is the one circulating in Hong Kong. We believe that it would be so because we're talking about locally infected cases. And every day we're talking about 200, 300 local cases. So probably they got it locally. And then for the variant, I believe that it would be consistent with the one circulating in Hong Kong. We'll get the results to confirm our idea. The second question is about vaccination. As far as I know, 7 out of the 8 involved had 3 doses. 1 got 2 doses. So all of them have been vaccinated, and therefore, yes, most of them have got symptoms, but upon inquiries, most of them had mild symptoms like a sore throat, etc. As to the transmission risk, we know that there has been an outbreak at this restaurant. We believe that it took place in the morning of the 1st of May. So probably there was a sort of silent transmission, a patron going there in the morning. So far, we have found 8 cases. We have already identified those who visited the restaurant in the morning on that day. Will follow up on their test results. Before I left my office, I knew that at least 21 of them had already undertaken a test and had got a negative result. So I believe that the patrons would be getting tested and getting their test results known one after another. As to the investigation, we have been following up on the information gathered. In the past, there was just too many cases. It was impossible for us to go after each one of them and ask them about their whereabouts. We are going to speed up our work. We try to find out their place of residence and their place of work. With cases coming down, we'll try our best to get more information, epidemiological information as far as possible, and we'll also beef up the manpower at the case tracing office. And for each and every case, we'll try to know about their whereabouts. With fewer cases, the greater depth we can dedicate to our investigative work. So far, what we are doing is as follows. That is, we try to look at their whereabouts before onset of symptoms, not confined to 2 days. We'll also get hold of information on the Live Home Safe apps, and then we'll try to see whether there have been clusters of cases at places that they have visited. For close contacts, we are mainly talking about 2 days before the onset of symptoms. And then whoever has come into contact with the case with mask removed, then it will be defined as a close contact and subject to quarantine arrangements. Well, if the case has been found out by nucleic acid test, then it means that we have already got a sample, and it can be dealt with at a private laboratory. Some samples, if necessary, would be transferred from a private laboratory to our public health services laboratory for genomic analysis. For rapid tests, if a citizen finds that his test result is positive, we do have a sampling sort of a random checking arrangement. We've been doing so for a period of time. For those having a rapid test result, some of them will be asked to undertake a nucleic acid test, and then the sample will go to the Public Health Laboratory Services branch, and then we'll try to see whether we are discovering any unknown variant or subvariant. For the case from Singapore, well, we only made an announcement yesterday. We're still analyzing the sample. I haven't got anything else to add. As to the 2 death cases, for the 70-year-old male not residing at any home and no vaccination record, 85-year-old male resided at a home with 2 jabs already administered. The lady over there. Good afternoon. I'm from TVB Doctors. First of all, Dr. Au, first of all, you talked about the hot pot restaurant. Before you left office, you said that about 21 patrons had undertaken a test. Were they all negative? So far, you haven't identified any positive cases, right? And then, as you have said, you are going to have in-depth investigation about their whereabouts. So does it mean that starting from tomorrow, you will then be able to tell us about the places they have been to? Well, for a number of days, we have 200 or so cases. So what is the way forward conceived by the SHP? Well, just now I referred to 21 cases. They had the PCR and the results were known. So in our system, it is said that they have got a negative test result. I'm sure there must have been many more such negative results. But then the CTN was only issued yesterday, so some might not yet have received the results, or they haven't yet started to go to a test center. Well, for the epidemiological investigations, all the time we have been relying on the online platform to collect information about the workplace, residential address, and home contacts of the positive cases. Via the online platform, we have been issuing the quarantine orders as well as the isolation orders. If a citizen gets a positive result, if it is a rapid test, then please make sure that you submit your personal information to us online. We'll come into contact with them. And then other than the workplace as well as the residential address of the cases, we'll also find out more about their whereabouts. We'll not be making announcements one by one. We have 200 to 300 cases each day. We do carry out the analysis behind the scene. The purpose is to identify places of high risk and to find out whether there has been any outbreak at any places. Should there be an outbreak, we will make an announcement, or you will even be issuing compulsory testing notices.
Currently, we hope to discover early, treat early, and reduce the number of cases in the community and stop the transmission. This is ongoing. When cases are low, we will do more contact tracing, and when we identify venues that have outbreak, we will strengthen measures and minimize the transmission vectors in the community. We need to stop the transmission and bring down the case numbers. Any other questions? That concludes the press briefing. Thank you.